Hi, I'm Dr. David Finkel, and I work at Finkel Cosmetic Surgery Center. In view of what's happening in the world today with the coronavirus and the pandemic, I think it's very important that we as professionals give some help to people as far as mask wearing, how to put a mask on, how to take it off, and what the difference in the masks are. So that's what we're going to do today. And I have some selections of different masks that are available to the public, and I think when we all go out into the public, for any reason, we should all be wearing a mask. I know it's not mandated by the government, however, it's good safety precautions, especially if you're going to the grocery store or someplace where it's difficult to stay within 5 to 6 feet of the next person. The first mask I'm going to show you is what we call the N95 mask. The 95 represents a number of the air particles that are filtered by this mask. So this is not the heavy N95 respirator mask used by the hospitals, which is much heavier. This one's a little lighter, but it also is a wonderful mask to use. It does have elastic straps, which makes it a little tricky to put on. So when you put this mask on, you should not have your gloves on first. We'll talk about gloves in a minute. And this fits over your head, and one of the elastic straps goes below your ears, and the second goes on top of your head. And yes, it does mess up your hair, but don't worry about that. Then the metal over your nose is firmed, and now you've got it. And it's almost airtight, and you probably have a hard time hearing me through this, but that's okay. When you take this mask off, especially if you have gloves on, you have to remember, if you're especially in a grocery store, your gloves are contaminated, and you need to remove your gloves first before you remove your mask. And when you take your mask off, you should take the top strap and pull it down, and then the second strap and remove that, and set the mask down, not touching the outside or the inside of the actual mask, and then washing your hands or using the hand sanitizer. I personally like to wash my hands and use the hand sanitizer. So that's a routine that you need to get into when you're handling the mask. As far as a more common mask that you may run into is the cloth mask. This mask here has straps that you need to tie on top of your head. So again, the placement of the mask is similar, where you place it over your face and then you secure it on your nose first. The first strap gets tied over your head, and you can tie like you're tying your shoe, a little bow knot. That bow knot is important because if your mask is clean, you're not coughing into it or it didn't get dirty, you can reuse this mask. The first strap goes over your head, the second one goes behind your neck. And again, when we remove this mask, it's the same as the other mask. You take the top half first, then you can undo the bottom. And again, if you've done a bow tie, you should be able to reutilize that mask. And same thing with the hand sanitizer and washing your hands afterwards. The third mask, and probably the most common one that we're seeing, is the homemade cloth mask, which in this case, I believe I have cupcakes and candy and desserts, and this side kind of looks like the COVID virus, so we're gonna not use that side. In any case, this one just goes right over your face and around your ears, and there you have it. So there's no metal strap to go over your nose, and this one, as you can tell, doesn't give you as much protection as either of the other masks, but it does give you some protection. It's important to know that these things are, even the N95s, are not going to stop all the aerosol. So you have to maintain your social distance between people. And if someone is obviously coughing or having a problem and the mask gets dirty, I would throw the mask away or launder the mask. The COVID virus is very, very sensitive to alcohol and soap and water. And with good hand washing technique and using a good hand sanitizer, even if you've got the virus on your hands, you can kill that virus. Even though it's highly communicable, it's easy to kill. So please do that, and remember with the gloves that you take your gloves off first before you take your mask so you don't recontaminate your mask with the gloves. Everybody stay safe, and I hope to see you soon. We hope to open our office around June 1st. Thank you.